My name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give a COVID update for New South Wales for Saturday the 6th of November 2021. There were 270 locally acquired cases of COVID-19 reported in that 24 hours of 8 o'clock last night. In the same period, there were more than 70,000 tests reported. In terms of vaccination across New South Wales, there are now 93.8% of people aged 16 years and over who have had a first dose of COVID vaccine, and 89.4% who are now fully vaccinated. In the 12 to 15 year age group, 79.87% have had their first dose, and 67.43% are now fully vaccinated. Sadly, we're reporting the deaths of 3 people who have been diagnosed with COVID, 1 woman and 2 men. A woman in her 30s from Western Sydney died at Westmead Hospital. She was not vaccinated and had underlying health conditions. A man in his 60s from Wollongong died at Wollongong Hospital. He was not vaccinated and had underlying health conditions. And a man in his 50s from Western Sydney died at Liverpool Hospital. He'd received 1 dose of COVID vaccine and had underlying health conditions, and we'd like to express our deep sympathy for the family and loved ones of these people who have died. There have now been 536 COVID-related deaths in New South Wales since the 16th of June 2021, and 592 in total since the beginning of the pandemic. There are currently 270 people diagnosed with COVID in hospital, with 55 in intensive care, 27 of whom require ventilation. Of the cases in ICU, 1 is aged under 10, 2 are in their 20s, 4 in their 30s, 10 in their 40s, 15 in their 50s, 17 in their 60s, and 6 in their 70s. Of the people in ICU, 44 are not vaccinated, 3 have had 1 dose of vaccine, and 8 people received 2 doses of COVID vaccine. New South Wales Health's series surveillance program, which identifies fragments of the virus that causes COVID in sewage systems, has identified positive results in 4 communities without known recent cases. These are Uralla, Dungog, Byron Bay and Denman. So everyone in these areas in particular is urged to watch out for symptoms and come forward for testing right away if you develop any COVID-like symptoms. So this weekend many people will be travelling to the regions in New South Wales to visit friends and family, and we need to remind each other to keep COVID safe when travelling. Please make sure you wear a mask, particularly indoors when you need to, carry proof of vaccination with you, and always check in using QR codes. And please don't travel anywhere if you're feeling unwell with possible symptoms. Go and get tested until you test negative. And a reminder, if you've returned from overseas recently, please follow the health guidelines and have a COVID test within the first 24 hours of returning and on day 7 after returning. And if you get any symptoms at all, please isolate until you get a negative result. And please don't visit any high-risk settings in the first week of returning. High-risk settings are places such as aged care facilities, hospitals and disability homes. But once you've received a negative COVID test on day 7 after your arrival, you can visit these places as long as you remain COVID safe and take those precautions, hand hygiene, using a mask and so on. But don't visit if you have any symptoms at all. And there are slightly different rules for children under 12. So thanks very much again for everyone for coming forward, for getting testing when you have symptoms, for getting vaccinated and keeping our community safe.